So we'll see how this goes. I'm gonna do my best, but I haven't done this skill in a long time. Last year, Dom was the one who tested out on this skill, so I have not practiced my own sterile surgical hand scrubbing in quite some time. So this is the Glow Germ. There's liquid and there's powder form. We'll probably be using the liquid unless we run out for some reason, but you need a very small amount. And so I'm going to ask all of you guys to put this on your hands first. This is acting as fake germs. So say you just finished a really yucky case and you were just covered in germs, but you needed to go help in a surgery. You have to get all of that off of you, right? And we have to be ready to go into a sterile field, so we're not just doing a general hand scrub, but a full surgical scrub. So overall, you should scrub your hands for a total of 5 minutes. I will be putting a timer on, and if you are completing all of the necessary scrub counts for every surface, you should meet that time limit. You guys obviously can have your watch on and kind of check yourself, but that should be the time length that it takes. What else? Yes, Sally, go ahead.
Is it okay if we go a little over?
It is okay if you go over. It shouldn't go under though.
Okay.
So, would you guys like me to do it and talk, or explain and then do it and talk?
But explain and then do it and talk.
Okay.
There we go.
So, firstly, you should have your hair up. You should be in scrubs. You shouldn't have jewelry on. I took my jewelry off my hands at least, guys. Give me some grace for my necklaces. I want to take them off right now. You should be in proper attire, and you should have no jewelry on your hands or your arms whatsoever. You should also prepare a scrub brush. So I will have these for you guys over here ready for you to grab. I will have to make sure that this one has in it what I need. I'll open it and check before we start. But you should have a scrub brush, and inside of the brush, once you open the packet, should be a little nail scraper. So make sure that you have all of your materials before you start. Usually most surgical hand scrubbing sinks will have an automated water on and off so that you are not having to potentially touch anything and possibly contaminate yourself. You guys could, like when we did our regular hand scrubbing, utilize the towel to turn the sink on and off, but you're still potentially risking some contamination there. So most actual surgery suites will have either like a foot pedal or a motion sensor to turn the water on and off. But for us, we don't have that fanciness, so yes.
How would we turn it off then?
With the towel.
Okay.
Yeah. And I'll probably grab a huck towel to show you guys the proper technique. So I might run away. You guys can pause and then turn it back on when I tell you. Go ahead.
And if you're to do this in real time, in the clinical time, would you want it to be exactly 5 minutes, like as short as possible, but the right amount of length, just because of, like, I don't know, if it's fast paced?
Yes. You don't want to overdo it. Like, there's no reason that you should scrub for 10 minutes. 6 would be okay, but trying to save time always. Yeah, the clinic is very fast paced. I could not talk today, guys.
It's okay.
All right. So the first thing you're going to do is open your scrub brush and set it to the side. Usually there's going to be a surface. So for you guys, I'll just tell you to use this small surface here. So you want to open it and set it down and turn your water on. The first thing you're going to do is grab that little nail scraper and go under each one of your nails. If you have to do it twice, if you have to do it 3 times, do it 3 times. Get all of the dirt, all of the gunk, all of the germs out from underneath your fingernails. When you're done with scraping, you're just going to toss that nail scraper. Whether this drain does not have a cover, so I wouldn't toss it in the sink. Sometimes that is just like regular practice, but for us, I'll probably move the trash can right here so you guys can just go over and drop. Again, we're prepping to be in a sterile field, so your arms need to stay above your waist at all times. The next thing you're going to do is wet your brush just ever so slightly so that it's covered in water, but you don't want to like squeeze it out necessarily and wet it again because you'll run out of the soap. These are pre-packaged with either like a chlorhexidine solution or an iodine solution, so antiseptics. So they'll either usually be like that brownish color or blue or pink. You will begin your hand scrub, whichever hand doesn't necessarily matter, but you're going to start on the outer surface of your pinky finger. Every single surface that you scrub, you're going to scrub 10 times. Every single surface. So 10 times right here.
Up and down.
10 times on the inside of the next finger. 10 times, 10 times, 10 times, and then you're going to go on the other side. So starting on the outside of your thumb. This side, this side, this side, 10 times for every surface. So now that you've done both sides of your fingers, all of your fingers, you're going to do your palm. When you do your palm, you're going to use those circular motions again like you did in your first one. So again, 10 times for the surface. Make sure you go to the end of your palm, and you can even do the flat surfaces of your fingers. Yes, go ahead.
Could you go over it again? Like, well, like, you know, in the surgical prep, how you have to do it in one swift motion without going over it?
Yes, I know what you're saying. You don't have to, you're not contaminating anything.
Yeah.
So you can go back to an area that you've already scrubbed. Yes.
Okay.
It doesn't have to be concentric circles that stop. You can scrub, and then you can do like your fingers this way if you wanted to. Yeah.
Okay. As long as it's 10 times.
Yes. Yeah.
Do you do open and counter?
Yeah, you should. So maybe 5 times this way, 5 times this way to have a total of 10, and then I would do your fingers each individually 10 times. Zoe, go ahead.
For the test, do you want us to verbalize every count out loud?
No, I'll be watching.
Okay.
I'm gonna set the timer, and then I'll be watching your counts.
Okay.
So if you would like to, you're always welcome to verbalize those, but I won't require you guys to. So we've done the sides of each finger, we've done our palm, we've done the palm side of the fingers, and then you're going to kind of close your hand, and you're gonna start from the fingernails, and then go to the knuckle, the back of the hand, and then the wrist. So again, 10 times every single fingernail. You should be doing the front surfaces of them and going over the top surfaces of each one. So whether you can do that all together or you want to do them one at a time, that is okay. You want to be thorough when you're doing this. The glow germ, when I have you guys apply it, I really have you guys like rub it in and like scratch so that it's under your nails. We want it to be accurate as to where germs get. So after you do your fingernails, the fronts, the tops, the sides, all the surfaces 10 times each, you're going to move up to your knuckles 10 times everywhere, right? So you're getting the backs of each finger, and then you're going to keep moving down your second knuckle, the back of your hand, and then you're going to go, usually it's about 4 inches of the wrist area, so just like before, and every surface. So I would probably do 10 times on this front surface, maybe 10 times on the sides, and then on the back. Again, making sure that your hands are not dropping below the waist at any point. Then you're going to do the other hand 10 times every single surface. So you guys can see, like, as you do 10 times for every single surface, you're going to be at 5 minutes. It's not going to, you shouldn't be worrying about the time necessarily.
Okay.
So once you've done both hands, all surfaces, both wrists, you're going to then get rid of your brush. So again, I'll have the trash can right here so that you don't have to drop it in the sink, just drop in the trash can. And then your rinsing technique is going to be the exact same as your general hand scrubbing. So making sure that your hands stay pointed up at any moment in time and that you do not touch any surface whatsoever. So again, really like getting down here and letting the water drip off your elbows. Let me go grab a Huck towel, but I'll try to show you guys with this one, that the Huck towel is more the correct shape to do this properly. So when you guys dry your hands, when you're getting, I'll have the Huck towels, so ignore me. But when you pick the Huck towel up, even make sure that you're not touching any other surface, okay? When you dry your hands, when you've done a sterile scrub, this is really difficult. I'm gonna get the Huck towel and show you guys after this, but you are going to use one side of the towel for one hand, and then you're gonna flip it. I'll show you how to do that. So if I had just got my Huck towel, I'm gonna dry, give me 1 second. Give me 1 second, guys. If you wanna pause your videos, that's okay. Yeah.
Yeah.
Drying hands. So one side of the towel for one hand. So again, starting at the fingertips, and you're gonna dry from the top down. So tops of the fingers move down the hand on all sides, and then move down the wrist. Once you hit that wrist area past the point where you scrubbed, you wanna stop. And then how you're going to flip this is you're going to grab the opposite corner and flip. I did that wrong. So you want to use the second side for the second hand. So you're going to flip and like inversely rotate. I don't even know if those are the right words. But you're using the other side of the towel from the opposite corner to dry the other hand. Again, starting from the fingers, going around the entire hand until you get to the wrist. And then you're gonna drop it just like everything else. Yes.
If you're drawing and then you go all the way to the wrist, if you go any lower, is that technically contamination?
If you have then contaminated the towel, your sterile scrub is not contaminated unless you go down and back up.
So that goes for everything. So start at the top and go down no matter what. Don't
So
go back
you
up.
can't dry one side and then go back up and dry the other side. You have to dry top to bottom.
Okay.
And then stop.
Okay.
Zoe.
So how we let the water drip to our elbows. How do we dry that?
So once you've gone down to each wrist, then you can always hit those little drips, but you really want to ensure that you're not touching that skin with your clean hand.
Does it matter, like, because you have to invert the towel. So if you dry the wrist and then you go with one hand to your elbow, and then you flip the towel, dry your wrist, elbow.
So
Wait.
once you flipped it the first time, both sides are technically contaminated at that point. So when you're getting those little drips, you don't have to reflip. It's just on that initial drying from the tops. You want to flip in between this hand and this hand.
Okay.
Okay. Any other questions right now? Okay, let me go grab a hot towel. I'm gonna check if this has the nail brush that I need, and then I'll do it, actually do it. And then we'll see. I'll turn the lights off in here and we'll see if the black light is strong enough to check in here. If not, we'll have to like squeeze in the closet or the bathroom or something so I can show you guys.
Okay.
Oh, yes, okay.
Would we have to, like, pre-open that?
Yes, you should.
Okay.
Let me go grab a hot towel and I'll be right back and then we'll do the whole thing. Sometimes like runners or you guys as like assistants or techs would be running through the clinic and checking for that sort of thing to throw it in the trash. Or after the surgery's done, when you go back in and scrub afterwards, when you're done, you don't have to go back into a sterile fill. You can pick everything up.
Okay.
But there's usually going to be either a trash can or like a bin nearby to dispose them in, so they're not just sitting around or on the floor, on the table or anything.
But since you're dropping it on the ground, would you, like, pick it up after the procedure? Okay.
Elena?
Can we just like go like this and then go down to get down?
Yeah. Yeah. But I'm not, because we don't have a shelf, I'm not gonna take it off if you pick the towel up. Because I'll probably pick the towel up. Okay. Glue germ first. Okay.
So I'm gonna scroll this a little bit in my hand.
Yeah. Yes, ma'am.
And then I really am going to ask you guys to rub it in. So every surface, and it's like an oil-based product, so it should spread out fairly well.
For the scale, are you gonna pour it for us, or?
Yeah, I'll pour it in your
Okay.
hands. Go down your wrist.
Do you feel it on your hand, or does it feel like?
It just feels like oily.
Okay.
It doesn't feel like a layer of stuff, really. If someone wants to run and hit the lights really quick, I'll show you guys what this looks like before I scrub it under the black light. Elena. Yeah, go ahead, hon. Elena, if you grab the black light and turn it on. There's a little switchy on the side.
Whoa. Wait.
Mm,
Is it?
it's hard to see. Let me use
Yeah.
the powder instead. It might be just
Oh.
not dark enough in here.
Whoa. Sorry, that looks cool.
Wait until you see it on someone's teeth.
Oh.
Oh, yeah.
Whoa.
Yeah. If
Wait,
you shine
what?
it on your teeth, they like glow like crazy.
You want that too?
Let's see.
Oh, yeah.
Okay, so you guys can see
Whoa.
that would all be germs. Let me try to
Is
spread
it
it out more.
Is it actually germs, or is it like
No,
a
this is
simulation
just
of
the.
germs?
It's a simulation.
Okay. Whoa, that's cool.
Okay, so you guys see?
Whoa, yeah.
Okay. Yes. Okay, so I'm really trying to spread it around for you guys, but okay. Go hit the lights again. Thank you, Tiffany. So I really like this skill because
Yeah.
of the fact that we use the glow germ. It really helps you guys visualize how much germs can spread. Because right now, if you had no idea,
Whoa. Can't even
right?
see it,
You would have no idea that I have that many germs on my hands. They look like normal.
yeah.
And then if I went around touching everything, so I'm gonna touch this right now for the sake of it, because I want to show you guys how germs spread. It's a very helpful visual when we use this. All right. So now that I'm ready to do my surgical hand scrub, I would have pre-opened my pack. So we'll pretend that it's already closed and I opened it, right? And then I'm gonna set it off to the side. So this is your little nail scraper. Okay, so your brush is in there. This is your nail scraper. So you're gonna be using the pointy end that's kind of tapered off. This part is for you to hold. So I would go ahead and turn my water on. And if you guys, again, this sink gets hot if it runs for a little long time. So if you want to give yourself a second and get the temperature right, I'm okay with that. I won't start the timer until you start with the nail scrubber.
Oh, okay.
So I'm gonna start and go under each fingernail, sorry. And don't be scared to rinse it off. It's gonna get dirty.
And you're just scraping all the dirt from underneath the
I'm
nail.
scraping as much as I can out from under each one of my fingernails.
Okay.
My fingernails are dirty right now, so this is great.
How would you do it if your fingernails are like really short?
Oh yeah.
You just still, it's fairly tapered on the end, so you still want to try to get under there if you can.
When you do a skill test, are you gonna like do the black light before and after?
Just after.
Okay.
How many more days are in March?
Wait.
Probably then.
Wait.
I've gotten as
are
much
you-
as I can out of these nails and then do the other hand. Go ahead.
Are you doing it like as fast as you can, or?
Right now,
Yes.
no, I'm not. I'm also very shaky today, so that's not helping my situation. But you can take your time on this. Again, you want to be thorough. You want to be as germ-free as possible. So again, if you go a little bit over that time, it's not the end of the world. But you don't want to be taking forever.
Okay. Would we be able to practice with the iodine, or are we just gonna like imaginary practice with it?
I'll probably I'll probably have a few sponges that have already been opened, and you guys can put like regular soap on them and practice with the sponges, and one of these will keep out, or two of them. But probably no practicing with the glow germ and with like a fresh sponge, just because we don't have that many.
Yeah.
And I don't want to run out when we're testing them.
Right.
I'm very shaky.
Okay. Is the plastic like a hard plastic or?
Yeah, you can feel it when I'm done.
Okay.
It's pretty rigid. So again, don't be scared to scrape under multiple times. This pinky nail of mine is the one that has been ripped off, so it grows really weird, and I don't know that I can even get where I need to get. But you would have to.
Absolutely.
You don't want someone sticking dirty hands in your abdomen.
Yeah. That would not be very nice.
Alright, so I'm going to say that's good for now. Again, I'm going to drop this, right? So for now, I'll just let you take it since you wanted to feel it. But I would either drop it in the trash can or in an available space. So I'm going to wet my hands real quick. I'm going to grab my brush, toss that on the floor. So you guys can see there's a lot of soap in it already, right? That's chlorhexidine scrub. So I'm going to get it a little bit wet, but not soaking wet. You can squeeze it a little bit, but try not to squeeze all your soap out. So then you're going to start scrubbing. I'm going to use both sides of this.
Okay.
I'm just going to get it a little bit sudsy first before I start my surfaces.
What does that mean?
Sudsy? Bubbly?
Okay.
Okay. So again, I'm going to start, I'm trying to turn for you guys so everyone can see. I'm going to start with my right hand on my outside of my pinky. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Next finger. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I'm going to do the outer surfaces. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, And then I'm going to do my palm. So I usually use this one on my palm. It's just a little bit more scrubby. If you need more soap, you can use the softer side. But 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I'm gonna go both ways 10 times. You don't necessarily have to.
10 times each both ways?
You can, or you can do 5 in both directions.
Okay. But just to be safe.
Yeah.
And does it matter the pressure
Mm,
of the sponge?
enough to get the germs off. Don't be. I mean, your hands can withstand you pushing and scrubbing pretty. Sorry, guys. Okay. Next, I'm gonna go to my fingernails. So I'm gonna scrub the fronts of them all, the tops, the sides. Again, making sure that my hands don't go below my waist once I've started this.
When you practice, do you refill the sponge with the regular soap?
Yeah.
Okay.
Okay, I'm gonna move down to my knuckles. Get down. The back of my hand. And then down to my wrist. Some more soap.
matter if, like, let's say, like, we want the soap a little bit more watery, like, during that time, can we still wet the sponge?
Yeah, you can re-wet it. Yeah. You don't want to do it too many times because you will start to run out of soap.
Okay.
Okay. I'm gonna do my other hand. I'm just going over everything one more time just to try to ensure that I got all the germs. Okay. Other questions right now, guys?
It doesn't matter what side of the sponge you use, right?
I switch it the whole time.
When you check this, is it okay if there's, like, one tiny spot, or is that, like, a pass or fail kind of thing?
You really shouldn't have any spots left. But if it's literally like one teeny tiny speck, I'll probably give it to you guys because it is a pretty hard skill to master and you guys are just learning. But you guys will see even like, I'm sure that it's dripping on me right now. You'll see that I'll probably have contaminated myself when we check at the end. And then I'll tell you guys like some frequently missed areas is like this back surface of the hand, the fingernails obviously, this little weird spot in your thumb area, and the wrist. I don't remember which finger I was on.
So it's okay if we, like, kind of contaminate ourselves because we're gonna, like, scrub ourselves in.
Yeah, so after this, if I was literally going to go into a surgery, I would be doing this hand scrub, and then I would gown up, I would glove up, I would put my hair cap on. So your surface of your clothing that you're in during this scrub is okay. Sorry, I keep flinging you all this soap. You'll do it to me when we test, so we'll be even. Okay, so palm.
You could do it like over once again when you're finished, just to
Yeah,
be safe.
I do.
Yeah.
Fingers. And your arms will start to get tired after you scrub. I promise.
Feel the burn.
So dry afterwards?
Huh?
Like, this
Does it feel dry afterwards?
No, the antiseptic that you're using is safe for use on skin, so it shouldn't like harm your skin in any way. You'll probably just feel extra clean, hopefully not dry.
Extra clean.
I can feel my hands after if you want.
Okay.
Back up my hand. Down to my wrist. And some doctors scrub to their elbows. It really just depends.
On the clinic, what
Yeah.
their preference is.
Some doctors just rinse their hands.
Oh.
Go right to surgery.
Oh, that's crazy. Will they like tell you, like when you go to the clinic, will they tell you what their expectations are?
Yeah.
On the first day.
Not every single one of their expectations on the first date because there's a lot, but they will tell you their way of doing things. Yeah. Oh, okay, drop my brush, so I'm done. I did all my surfaces. I was just doing a quick overview of everything, right? So
Yeah.
if that happened, what would you do in real life?
Get another one.
Probably get another scrub brush if you weren't done yet. Yeah.
So would you start over or would you just?
No, you can continue from where you were at.
And then you would leave it in there and wouldn't
Yep.
touch it at all
Until
until.
after the procedure's done or someone else will do it.
Okay.
So I'm ready to rinse. Again, keeping my hands upward, making sure I don't touch the faucet, the handles, the sink, nothing. So starting at the fingertips, letting everything run down.
For about how long should we then?
As long as there are no soap bubbles, like if you just give it a second and make sure that there's no soap bubbles, so like I would probably keep rinsing that one. Sometimes it's hard to tell if it's water bubbles or soap bubbles, but if you just give it a second, the water bubbles should disappear. So, okay.
So can we keep going back and then going down?
Yeah, as long as you don't drop your arms.
And then, well, the soap on your elbows would also rinse naturally, right?
Yeah. Okay, so a good rinse. I'm gonna leave the water on. Turn this way for you guys. So I did not drop my hands below my waist. 10. So I'm gonna use this first surface of the towel to dry my first hand, starting up at the fingers. Once I get to that wrist, and again, right here, make sure that none of your fingers are going to be touching your skin on the other side.
Okay.
So even potentially right here, you could go ahead and dry your elbow if you wanted to. I'm gonna hold it up, and I'm gonna grab this opposite side, and now I'm using the other side of the towel, starting from my fingertips.
So you couldn't touch, like, with your left hand, you couldn't touch the other side when you're flipping it?
You shouldn't. Not
Okay.
necessarily, no.
So kind of like in the way that, like, the surgical pack, when you're opening it, and if it flips, you have to go from the outside and, like...
I
I
should
don't
have turned
know.
the sink off before I dropped the towel.
But
Sorry.
in the clinic it was kind of automatic to turn off.
Yes.
Yeah.
Okay, so someone grab the black light. Go turn the lights off for me. We'll see how well I did. Dun, dun, dun. Okay. So look right there, where my calluses are.
Oh, yeah.
You can see there's germs stuck there still. I can see 3 spots right there.
Wow.
What about my fingernails? So my fingernails are still a little bit dirty, even with me scrubbing them that much. There's a pretty good speck right there. Let's see. So where I stopped on so my wrists are clean up until the point where I stopped scrubbing.
Right.
So there's still germs all right here.
So would that be okay or?
This, if it's below your 4 inches, I'm not going to take points off for it.
What about your calluses and...
This, yeah, this is not okay.
Okay. I did notice that you were scrubbing your left hand a lot more. Like you spent more time on it. So
Yeah,
definitely
and that's
made
relevant.
a difference.
I mean, it's you can see that I scrubbed this one more.
Yeah.
So this nail is pretty bad.
Yeah.
Yeah, let's see the sink.
Oh,
and
yeah.
what about me? Oh, you can see where it splashed? Right here. Look at the sink.
Whoa.
Whoa.
Look at the handle. Right here. Everywhere it's splattered. So this really should help you guys visualize just how easy germs can contaminate everything. Let's see my towel.
Oh my god, my shoes.
Not too bad. I think it's just dirty. But the sink is a very good representation, and that callus on my hand for sure.
So would that be an immediate fail?
Yeah. What you got on you? But yeah, and in scrubs, it's a lot easier to see contamination, but almost
yeah.
always you're gonna have like a line of contamination here And then you can see all the splatter marks on me.
Wow.
Okay? So we'll keep practicing. Don't be afraid to scrub. Look at all those germs.
Yummy.
Yeah.
What about this thing?
Oh yeah. Oh yeah, look at that. Yucky. At least it's fake germs right now.
Yeah.
Your phone case is all bacteria.
Let's see. No, it's
No,
just
it goes in the dark. It goes in the dark.
Oh, okay.
Bacteria.
Could I see my legs? Because Refuge was. Oh my god, Refuge is so clean. Clean them.
Will someone go turn the lights back on for me?
Oh, sorry.